Good evening, everyone. Jim Shaw, your guest host today on Down the Road. This is actually the first time I have guest hosted this show, so if I seem a little shaky or confused, it's only because I am. Let me give you a little background about me before we get to our guests. I received my bachelor's and master's degrees in journalism from Northwestern University in Chicago. I was Washington correspondent for several radio stations in Illinois and Texas. I was a longtime television reporter for WDAY TV in Fargo, covered thousands of stories. From there, I became news director at KVRR TV. Not only was I news director, but I was assignment editor, reporter, and political analyst. While I was doing all that, I also taught broadcast journalism at Minnesota State University in Moorhead. And for the last 7 years, I have been a columnist for Forum Communications. So you can read my columns in the Fargo Forum, Grand Forks Herald, Jamestown Sun, and Dickinson Press. As for today's show, the second half, we're going to talk about the Holocaust. This is Holocaust Remembrance Month. But our first topic is going to be COVID-19. So our first guest is Dr. Stephen Mcdonough, longtime public health officer for North Dakota, longtime pediatrician, just retired, a real expert on COVID-19, and I consider him to be the Dr. Fauci of North Dakota. Dr. Mcdonough, welcome to Down the Road.
Good evening. Nice to see you.
Nice to see you. Thank you so much for joining us. I'm going to really tap that wisdom of yours. So let's start off by having you tell us, how has COVID-19 affected the state of North Dakota?
Oh, it's been devastating. The worst pandemic in 102 years. It overwhelmed our healthcare system. 1,484 North Dakotans have died. We probably will get up to 1,500. This is the big one that we were been dreading for years, and we didn't do a real good job with it. It devastated nursing homes in rural areas. Many rural counties were hit extremely hard. So this was a pandemic that was very, very tough in our rural areas, particularly with our elderly and vulnerable population. Overwhelmed healthcare systems, public health workers were threatened. A lot of nurses in nursing homes and doctors in hospitals and saw patients needlessly die and are dealing with some post-traumatic stress. So, this was a devastating blow to our state, and words really can't describe the horror that it inflicted in a lot of our rural nursing homes. Overall, 1 out of 4 nursing home residents in our state who got COVID died from it. It was 26%. This was a very serious disease, and we should have done a better job than we did.
Well, following up on that, how would you say the government in North Dakota handled dealing with COVID?
Overall, I think the workers who were working hard did their best. The leadership was terrible. Basically what happened, North Dakota took an unproven and untested political approach, which was a light touch of government and individual responsibility for the worst pandemic in 102 years, and it failed miserably. During most of the pandemic, before we had the mask mandates, North Dakota was among the worst in mask wearing and social distancing. And what happened after Labor Day, we had huge spikes in cases in communities because people were not wearing masks. And that got into the nursing homes with the staff, and they spread it to the residents. And the consequences were terrible. And what was even worse than taking this untested political approach to a pandemic was that they didn't even know enough about public health to evaluate what they were doing. So public health is a very science-based discipline, and they're constantly evaluating how they're doing and how they can improve it. You have to justify your funding you get from the federal government. I mean, I worked in public health for 15 years at the health department, and you're always evaluating everything. And the North Dakota government wasn't even evaluating how North Dakotans were doing on mask wearing. They had no idea we were doing terrible. So when Dr. Birx from the Trump administration came to Bismarck on October 26th, and this now is, we're 6 months after CDC recommended people wearing masks in public, and we're 2.5 months into Mask Up North Dakota. And she says Bismarck was the worst that she had seen in all the states that she had been to. That just tells you that North Dakota's public health approach was a failure. The leadership did not know what they were doing. It was amateur hour, cluelessness. They didn't even know enough to evaluate what they were doing. And what happened the next month? We had 499 North Dakotans die in November. We had the highest case outbreak and death rate in nursing homes in the country then. And it was all due to a lack of good leadership in our state, not even knowing the basics of what you should be doing in public health. There are two states next to us on the east and west side, Montana to the west, obviously, and Minnesota to the east. They did their mask mandates in July. Yeah, their death rates are much lower than North Dakota's. South Dakota to our south has done they've just been barbarically cruel in their public health approach there. They've basically done very little other than testing and some local mandates. I mean, their death rate is much higher than ours. So I estimate that the fact that we delayed our mask mandates, that we lost over 650 grandmas and grandpas in our state by not having a mask mandate on or before September 1. Now, if we would have done it in July, we'd have probably had more lives saved. But Dr. Birx, again, from the Trump administration, estimated that a lot of the deaths after May, end of May, were preventable in our country. And we're talking hundreds and hundreds of thousands of preventable deaths in our country and hundreds of preventable deaths in our state. So there need to be some lessons learned from this. We should never, ever do this again. When the next pandemic comes, we shouldn't even be talking about a light touch of government and individual responsibilities, because those failed. We need to protect our grandmas and grandpas. We need to value the sanctity of human life, and we need to do the right thing. And we did not do that soon enough.
I want to talk to you about mask mandates. First of all, did the governor drop the statewide mask mandate when he did it in January? Did he drop it too soon? And also, what do you think about the legislation that was passed by the North Dakota legislature to ban statewide mask mandates in the future, which fortunately Governor Burgum has vetoed, but we don't know how that's going to play out. They might override that veto. So what do you think about dropping the mask mandate in January, and what do you think about the legislation that would ban future statewide mask mandates?
Yeah, he dropped it too soon, way too soon. Our hospitalizations are up. We're seeing new variants out there. You know, the deaths have gone up. We're still people are still dying, still being hospitalized in our state. We have as many people hospitalized right now under age 60 as we do above age 70. So we've had we've had athletic performances or contests delayed. We're having nursing homes now that are getting cases again in their staff, and they're having to ban all visitors from going to the nursing homes. So our elderly in our nursing homes are not getting to see their loved ones right now. So there's a number of reasons we should have kept the mask mandate. Yeah, we should still be in a mask mandate right now until CDC tells us that we shouldn't be needing it anymore. So that was very unfortunate. Yeah, the legislation that was passed, House Bill 1323, is one of the worst pieces of legislation I have ever seen. I mean, it's obvious in our state that the mask mandates that were implemented saved hundreds of lives, absolutely hundreds of lives. I estimate 400 and 1,000 hospitalizations in just 3 months when our mask mandates went into effect in October and November. And to have the legislature pass a law that would outlaw that, you're basically declaring open season on grandmas and grandpas the next time the next pandemic comes through. They're going to die. If you don't have a vaccine, we have a new virus that comes through that's spread through respiratory droplets that masks will help, and you don't have a vaccine for them, and it's deadlier than the one we've had right now, you're basically dooming hundreds of grandmas and grandpas to die in our state. You not value the sanctity of human life. It's a terrible piece of legislation, and basically prohibits the governor and the state health officer for doing a mask mandate. I mean, it's almost speechless that someone even would consider that. But we're in the era of anti-science. We're in an era of people not believing truth. You know, they come to their positions and they're too stubborn. And it doesn't matter how much proof you give to them. The masks are like 70% effective at reducing transmission. You throw on 2 masks, you're getting up to 90% effective. I mean, that is a fact, okay? COVID is serious. It's 14 times as deadly as influenza. So the COVID deniers were wrong. This is not like influenza. It's 14 times as deadly. And if you're in a nursing home and you get it, it's 260 times as deadly. So the COVID deniers we had to deal with, and there were plenty of them in our state, they were wrong. The anti-maskers are wrong, and we just passed terrible legislation. I'm just hopeful there's enough House members and senators who value the sanctity of life, who value their grandparents, and will uphold the governor's veto.
Dr. Mcdonough, I want to talk to you about a lot of the bad information that has been out there since this pandemic hit. So you touched upon a little bit about it with the flu. I want to talk to you about masks and mask mandates and vaccines. So we're going to do that right after we take this break. So hang with us. We'll be back in a few minutes with Dr. Stephen Mcdonough right here on Down the Road.
Howdy folks, it's a Line Cafe. I reckon it's time you'll do for a hearty meal. So saddle up for the day with one of our hay-bossing breakfast homemade soups. Fill your grill at a salad bar, sink your teeth into our famous Line burger and barbecue ribs. Top it off with spoon-rattling pie with a calm roll that's sure to put a smile on even the toughest outlaws. Shake the dirt off the boots each night and warm up with the game. Tell them about it, Stacy.
I can't wait to see you at the county line.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing, because life's been pretty worry-free since I got coverage with American Residential Warranty.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even pools and spas, and so much more.
Call American Residential Warranty. They'll get you covered.
1-800-219-1467.
Hi, Hunter Ellis here for Night Hero Binoculars by Atomic Beam. These binoculars let you see anything, even in pitch black darkness. Gotcha.
The secrets are powerful wide-angle atomic beam laser that reveals objects up to 150 yards away, hidden by darkness. During the day, Night Hero gives you 10 times magnification. And when the sun goes down, press the Night Bright button to see clearly in the dark. Light up garbage-eating critters or spot thieves before they even get close.
Call or click now and get Night Hero binoculars for just $39.99. Order right now and you can double it.
Plus, get our best-selling atomic beam flashlight, just pay a separate fee.
We'll even ship them to you free.
This TV special offer is not available on Amazon. You can get it all, but you have to order now.
Call 1-800-619-1091. That's 1-800-619-1091. Or visit bynighthero.com. That's bynighthero.com. Order now.
Attention, have you or a loved one suffered from maculopathy, a serious retinal injury, after taking the prescription drug Elmiron for interstitial cystitis or bladder pain syndrome? In 2018, a researcher at the Emory School of Medicine linked Elmiron, a prescription drug that treats interstitial cystitis or bladder pain syndrome, to maculopathy, which is sight-threatening and can cause an abrupt change of vision. Call Elmiron Justice for a free legal consultation.
Please call 800-395-5680.
Non-attorney spokesperson. This is a paid advertisement for legal services sponsored by Nightline Legal. Cases assigned on a random basis to participating law firms. This drug remains approved by the FDA. If you or a loved one regularly took Zantac and were later diagnosed with cancer, call right now. You may be entitled to financial compensation. Potential cancers include bladder cancer, colon cancer, kidney cancer, stomach cancer, liver cancer, pancreatic cancer. Do not stop taking a prescribed medication without first consulting with your doctor. Discontinuing a prescribed medication without your doctor's advice can result in injury or death.
Call 1-800-230-9210.
We are back here on Down the Road. Jim Shaw, your guest host. Our guest right now is Dr. Stephen Mcdonough, a longtime North Dakota public health officer. expert on COVID-19, longtime pediatrician, and just retired. So, Dr. Mcdonough, before we talk about COVID again, how's retirement going?
It's going really good. Thanks for asking. I have 3 golden retrievers. I walk 3 times a day, at least a mile. I have some hobbies, genealogy. I do a lot of nature photography, wildlife conservation, focus on connecting children with nature. So those are some of my hobbies, and I'm still working on, studying what happened with COVID in North Dakota.
And I'm delighted that you are. We need to hear your voice, an expert voice. I want to ask you about some things, because there's so much bad information and people say things that are just not true. So let me ask you about a few topics. Let's start with number 1, masks. Do masks work?
Yes, they're highly effective. And before the immunizations, they were the most important thing for us to do. That plus social distancing and getting tested. But masks by far are number 1. They're 70% effective if you wear 1 mask, 90% effective if you wear 2. Multiple studies have been done. The virus is transmitted on little aerosols that are created when we cough, sneeze, or talk. And the masks really block those. So they're not 100% effective, but they're inexpensive, very cheap, highly effective, and we should have been all wearing masks to save our grandmas and grandpas. No question about that. That is irrefutable proof.
Let's take it to the next step. What about mask mandates, which people get really upset about? They say their freedom is at stake. Do mask mandates work?
Yes, they're highly effective, and we saw that in our state. So prior to our mask mandates, we led the world. Can you believe that? North Dakota had the greatest outbreak of COVID in the world and the greatest death rate for nearly 2 months in the world, okay? The mask mandates went into effect. Our hospitalizations and cases and deaths dropped like 80 to 90% within 2 months. At the end of that 2-month period, we had the 3rd best COVID situation in the United States. It was dramatic improvement. That's where we should have been all along. Now, what happened since our mask mandates went away? Our cases and hospitalizations of deaths have gone up again. I mean, it's a no-brainer. We had the experience right here in North Dakota, and to our state to the south, South Dakota, we were the worst in the world. Well, who yanked that terrible distinction from us? It was South Dakota, okay? As bad as we were, South Dakota shot way above us, and they are much slower coming down. So their hospitalizations are twice what they are, active cases, same. They are in a worse of a hurt bag, and their death rate is now much higher than North Dakota's was. So they really failed. We did a terrible job, but they went way worse than we did.
All right, let's clear this up then, because a lot of people make the argument that North Dakota had a mask mandate, South Dakota never had a mask mandate, and some people are spewing information that basically North Dakota and South Dakota ended up the same. So you're saying there was a big difference between North Dakota and South Dakota?
Yeah, I estimate we saved 400 lives by our mask mandates. If we didn't do that and we ended up as bad as North Dakota, we'd be pushing 2,000 deaths rather than 1,500. So South Dakota has a distinction of the worst leadership, I think, in the country by far. And we were right with them until we did the right thing for 2 months. And look where, it had a great benefit. So people are, the problem we had in our state with the lack of leadership we had in our state is our leaders did not define the issue on mask use, okay? True leaders define the issue. They don't let the opponents define the issue. True leaders define the issue. This was an issue about sanctity of life. It was about protecting our grandmas and grandpas, our healthcare providers, our families. This was about life. That's what masks were, okay? And when you allow the opposition to come up with all this garbage, this non-truth, and to say that it's a right, you have a right to not wear a mask, well, there's no such thing. There's no such thing as a right to not wear a mask in a pandemic when masks are effective. I mean, it's ridiculous. You won't find that in the Constitution. It's a made-up thing, okay? Made-up thing by conspiracy theorists, anti-maskers, COVID deniers, and they were wrong. And the problem is that they were dead wrong, not maybe for themselves, but they were dead wrong for hundreds and hundreds of our grandmas and grandpas in the state. And what people are going to look back and time goes by, and they're going to look back and you said, what? You guys all didn't mask up to save your grandmas and grandpas. How selfish and cruel could you be? That's what happens when you're going into communities and going before the legislature and passing laws that prohibit mask mandates. That is selfish and cruel and not respecting the sanctity of human life.
Very well said. So now we have vaccines out there. Any adult can have one. And yet a lot of people refuse to get vaccinated. Some are scared. So should people get vaccinated? And do they have anything to be afraid of if they do get vaccinated?
Yeah, people should get vaccinated. They're highly effective. We've had 3 vaccines. 2 are wonderful. I've been vaccinated. I mean, you get some achiness and some side effects for them, and there are some rare side effects. I mean, like 1 in a million type of things with these clots with the Johnson & Johnson vaccine. But these side effects are very rare. This virus is a nasty virus. I think it's really important that we have good education. Before you talk about mandates like with a mask mandate, we should have had several months of effective education on masks. When you provide good education to folks when it comes to doing like a mandate with a mask mandate, you're going to get a lot more support for that. With immunizations, I don't think people are talking about mandates right now. But we need to do effective education, and you need to find ways to reach those folks who are resistant, okay? And there's ways to do that if you know what you're doing. The trouble is we had leaders in our state who did not know what they were doing. They did not know how to communicate to folks about the value of wearing masks, for example. So North Dakota apparently is 3rd highest with the vaccine hesitancy, and that's going to take some work. That's going to take some leadership. And it's about time our state actually did have some leaders that can step up to the plate and deal with the issues at hand.
So, Dr. Mcdonough, where are we at right now, today, when it comes to COVID-19 in North Dakota?
Well, we're right in the middle of the pack right now. We've slipped back from one of the best after our mask mandates to the middle of the pack. We have still people dying. We have 40 to 50 that are hospitalized. We're seeing some younger cases being hospitalized, and people are still dying. You know, so I guess we're doing. We're better than we were, but we were worse than the world. I do want to take, at least some time to talk about all the heroes in regarding COVID in North Dakota. The healthcare providers, the public health workers, the National Guard members, the long-term care providers, including the 6 who died taking care of our grandmas and grandpas in nursing home, the civic leaders in our state that stood up to the anti-maskers and COVID deniers and passed their local mask mandates. The leadership in our state came from the communities. It started in Fargo and Minot, and throughout our state in October and early November, our civic leaders did what our governor should have done, and they did the courageous thing and enacted mask mandates. So I have great respect for the thousands and thousands of North Dakotans who worked their tails off and were very courageous in dealing with this terrible virus.
We have about 1 minute left. What should we be doing now? Your average North Dakota citizen, our government leaders, what should we be doing now when it comes to COVID-19?
Wear your mask when in public. Be respectful about social distancing. Follow advice that's coming from the CDC. Get your vaccine. It's pretty simple. It's not all that complicated. I mean, get your vaccine, wear your mask, and be careful about social distancing and following the advice you're getting from Dr. Fauci at the national level and the CDC. They're giving you more accurate advice than what we're doing in North Dakota about basically stop doing things. A lot of the businesses are still requiring masks. Healthcare systems are still requiring masks. The rest of us should be doing it. Wear your mask. Get your shot.
You're right. And I will not go to a business that does not require masks. So it's good business for people like me to have masks.
In Utah showed that if you have a county mask mandate, there's more economic activity. If you have a statewide mask mandate, economic activity increases. Mask mandates are good for the economy, in addition to grandma and grandpa and healthcare providers and your family and yourself. It was a big win-win that we didn't do for a long time.
Dr. Mcdonough, I can't thank you enough for coming on here. I hope that you have opened up some eyes here. We need to do better. We can do better. And thank God for people like you who are telling us what we need to hear, what we need to do about dealing with COVID-19. So thank you so much, and keep fighting the good fight.
Thank you. Okay.
And we will be back to talk about Holocaust Remembrance Month right after this break on Down the Road.
Hey everybody, I'm Doug Billings, your host of The Right Side with Doug Billings on Beck News. We bring you high-profile guests, ladies and gentlemen, exclusive guests. Now, you're not going to see these guests in most of the mainstream media outlets. Another thing that I do here is give guests a platform to speak freely. You're not going to see me censor anybody. Please join us, won't you? Weeknights right here on Beck TV and online at beck.news. Cheers.
Hello, I'm Mike Lindell, and as you know, my passion is to help each and every one of you get the best sleep of your life. That's why I created my new Giza Dreams bed sheets. The first night you sleep on my sheets, you'll never want to sleep on anything else.
Go to mypillow.com or call the number on your screen right now to get your very own MyPillow Giza Dream sheets. When you buy one set of sheets, you'll get another set absolutely free.
For the best night's sleep in the whole wide world, visit mypillow.com.
Introducing the Cool Turtle, the ultra-comfortable mask enhancer that creates a protective, cool, and breathable space between your mask and your face. Simply slide under any mask or gaiter and immediately feel the refreshing pocket of air surrounding your face. Cool Turtle's ergonomically designed, soft, comfortable shell immediately reduces mask friction, allowing you to breathe and talk in a comfortable environment.
I can actually breathe. With the Cool Turtle, no more sweating.
It's like I don't even have a mask on.
Call now and get not one, not two, but 3 Cool Turtles for just $10. Order now and we'll send you 2 more Cool Turtles free. No fees, absolutely free. Plus, you can get a 10-pack of 4-ply face masks. Just pay a separate fee. This offer is not available on Amazon. Get the real Cool Turtle now.
Call 1-800-270-1219. That's 1-800-270-1219. Or visit getcoolturtle.com. Order now.
Indoor football is back in Bismarck. Bucks football season is right around the corner. Grab a friend or family member for a night of action-packed, hard-hitting entertainment. The Bucks open at the Bismarck Event Center May 8th as they take on the Massachusetts Pirates. Catch the sweetest seats in the house right on the sidelines with VIP service at a Bucks turf table. Available now for single-game purchases. Secure your tickets today by calling 701-595-0771. Bucks football, half the field and double the fun.
I'm Rick Becker from No Apologies. Welcome to your after-hours oasis of sanity. How can these people not see that they're just clowns?
We help simplify and educate you on things going on in the legislature and around the country.
Asking the hard-hitting questions.
But also having Lee Stack and Sid and Marty Croft stuff, and we've talked about that sometimes. It's bad.
Watch us weeknights at 9 Central on Beck News and online at beck.news.
Welcome back to Down the Road. Jim Shaw, your guest host here. Our next guest is probably a woman familiar to many of you. Her name is Dina Butcher. You might know her because a couple of years ago she was one of those badass grandmas who convinced North Dakota voters, rightfully so I might add, to pass an ethics measure. But I'm having her on the show today because April is Holocaust Remembrance Month. And Dina has a chilling and very sad personal story to tell us about the Holocaust. And she's been gracious enough to come on and tell us that story. So Dina, welcome. So nice to see you again.
Good to be on with you, Jim.
Thank you. So let's go back in time. In the 1930s, your mother, who was Christian, and your father, who was Jewish, were married and living in Germany.
Exactly.
In 1933, Hitler and the Nazis come into power. So, what happened to your father and mother after Hitler and the Nazis came into power?
Well, one thing, they were married in 1931. In 1933, that would have been illegal, and it became illegal because Jews were not allowed to marry Christians, and they weren't allowed to have Christians in their homes as maids or helpers either. But that's another story. Things started to, my father, who had not identified that strongly with the Jewish religion, this family story has it that the rabbi kicked him out of Hebrew school for being a bad boy. But he more identified, like so many Jews did, with being German than he did as being Jewish. So when things started to sour with the laws that got passed, like the one that said that his marriage was not legal, it was also that Jews could not own property. And he was a farmer and had horses and cattle in northern Germany. So it was illegal, and they had to ultimately sell all that. But that was after the real pivotal point that my mother, I think, pretty much said, we're getting out of here. Even though her relatives said if she stayed with the children, everything would be just fine, blah, blah, blah. Wouldn't have been the case, as we will talk about, as what happened to the rest of his family.
All right, so let's fast forward a little bit. November 1938, an infamous event takes place called Kristallnacht. Many Jews were rounded up in Germany and Austria. Many were killed. Many Jewish-owned businesses, stores, homes, synagogues, all destroyed. What happened to your father on Kristallnacht?
As the family lore goes, he was out working in his field, and of course they didn't have instant messaging in those days, so he probably didn't know what happened in the town where the synagogue was, which would have been Norden. He was in his field tending to, there were sugar beet farmers over there, and friends, I suppose, or at least school acquaintances came and took him out of the field and took him to a holding place, which was an old slaughterhouse or auction barn in Norden, put him on buses to Oldenburg with Jews from that area, men. They did not take women at that time. They then transported them to Oldenburg, where they put them on, I believe, a train and took them to Sachsenhausen, which is also called Arienburg in some literature. And that was where they were
Let me interrupt just a bit. Sachsenhausen was a notorious German concentration camp.
Right. At that time, they were not exterminating Jews. Let's put it that way. They were harassing, they were encouraging them to leave, and they were obviously seizing their property and taking away their rights.
All right. Your father, it's not all right, but I'm just saying all right in terms of the story progressing here.
Yeah.
Your father is in the Sachsenhausen concentration camp. Was he able to get out? If so, how did he get out?
As I said, at that point in time, as you read in a lot of the novels and so on, they were doing more to terrorize Jews. And he was put to hard labor. They were digging holes, and he was, being a farmer, he had a whole lot more strength than a lot of the people that he was incarcerated with, who were shopkeepers and so on. They were not well fed, and they were harassed. They were made to feel like lesser human beings. And my dad was a very proud man. My mother's family put up pleas to, and some of her family were Nazis, which became what you needed to belong to get anywhere and to keep your jobs in some instances. So they put out the plea, and he was out, and documentation shows that he was not. He was there for maybe 3 weeks. But family literature, family lore had it that he was there for 6 weeks. When he returned, my mother had already made appeals to a village friend who lived in Gordon, Nebraska, to be their sponsors so that they could come to the United States. And he had turned them down a couple times, but he then, after I think a third plea through his father, who was the village baker, he had a ranch, bought a ranch, was able to employ my father in the occupation that he had, and they began the process of getting out of there. Of course, they had to, I mean, he came back to having to sell his farm, which was also owned by his mother. I mean, part ownership by his mother. And they couldn't take any money out. He had to sell it for a pittance. And what can I say? It was a very difficult time. And there were my brother, 3 siblings were all little kids at that time. My brother was 7, his sister would be 5, and my next oldest brother was 3.
All right, I just want to back it up a minute. After your father got out of the concentration camp, and not just immediately, but for life, how did being in that concentration camp affect him?
As I understand it, he was a broken man. Oh, he was very proud. He had his own breed of horses, of which he was very proud. And he was well known in the area. His family had lived there for years. Actually, my grandfather had been instrumental in bringing electricity to this northern part of Germany, like the co-ops here, the REC equivalent in Germany. So they were very much an integral part of this small Ostfriesisch community in northern Germany.
All right, let's pick up the story. So, your father and mother, your siblings, all right, they have applied to come to the U.S. They were able to come. Meanwhile, and before that, I should emphasize that he went to Holland for a short period of time. Still in Holland, however, are several close relatives of the family. So exactly. Who is in Holland as your father is trying to make his way to the United States?
He had 3 sisters, one of whom was married. His oldest sister, Sophie, was married to a Dutchman. He lived both in Germany and in Holland, which was very close. That couple had 2 children. One was 17 and one was, I believe, 13. And then 2 unmarried sisters. Both of whom had trained as nurses away from their small village, but they were all living, and his mother, who at that time would have been 63. They all decided to stay on Uncle Ellie's property somewhere near Leiden, Holland. I think it's pronounced Leiden. My father wanted his mother to join them, and he at least wanted his niece and nephew to accompany them because it was looking pretty dark. But like so many Jews in Holland and Germany and elsewhere, they felt that this was going to not become what it did become, that it was not going to be a full-scale murder. So they convinced themselves to stay. And my parents sailed on the 10th of November out of Rotterdam after having to go to the border a couple times to get into Holland. But they did sail out of Rotterdam. And just to put it in a historical context, Poland had been invaded. Austria had the Anschluss. It was closing in. Holland had not yet been taken over. But that came very shortly after that, I believe, if I have my historical timeline right.
Right. Dina, I just want to mention, we showed a picture a few seconds ago that is of your grandmother, your father's mother, and we're going to talk about what happened to her and the rest of your family in Holland right after this break. So we will be back to talk more with Dina Butcher on Down the Road right after this.
Hello, I'm Mike Lindell, and as you know, my passion is to help each and every one of you get the best sleep of your life. That's why I created my new Giza Dreams bed sheets. I started by using the world's best cotton called Giza. It's only grown in a region between the Sahara Desert, the Mediterranean Sea, and the Nile River. It's ultra soft and breathable, but extremely durable. My Giza sheets also include full 21-inch wide pillowcases that will fit over any pillow and deep pocket sheets that will fit over any mattress. The first night you sleep on my sheets, you'll never want to sleep on anything else.
Go to MyPillow.com or call the number on your screen right now to get your very own MyPillow Giza Dream Sheets. Giza Dream Sheets are available in a variety of colors. Use your promo code, and for a limited time, when you buy one set of sheets, you'll get another set absolutely free.
For the best night's sleep in the whole wide world, visit mypillow.com.
Non-attorney spokesperson. This is a paid advertisement for legal services sponsored by Nightline Legal. Cases assigned on a random basis to participating law firms. This drug remains approved by the FDA. If you or a loved one regularly took Zantac and were later diagnosed with cancer, call right now. You may be entitled to financial compensation. Potential cancers include bladder cancer, colon cancer, kidney cancer, stomach cancer, liver cancer, pancreatic cancer. Do not stop taking a prescribed medication without first consulting with your doctor. Discontinuing a prescribed medication without your doctor's advice can result in injury or death.
Call 1-800-230-9210.
Seniors, are you aware that you could pay less for your car insurance?
Seniors can save money on their car insurance.
You might save a little, you might save a lot.
Maybe hundreds of dollars a year.
You might save 5% a year, maybe 10%, 15%, or even more.
That's a lot of money. So call right now and find out just how much money you might be able to save.
1-800-699-0761. 1-800-699-0761.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing, because life's been pretty worry-free since I got coverage with American Residential Warranty.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even pools and spas, and so much more.
Call American Residential Warranty. They'll get you covered.
1-800-219-1467.
Watch No Filter with me, Debbie Schlussel, for no-nonsense, unfiltered analysis of the news that matters to you. You'll see engaging guests.
It began a 444-day nightmare.
Entertaining analysis. And it has everything to do with something that happened in history. And honest movie reviews. Trust me, this is just atrocious. No Filter with Debbie, weeknights at 10 p.m. Central on Beck News and online at beck.news.
Welcome back. Jim Shaw, your guest host here on Down the Road. We are talking with Dina Butcher from Bismarck about the Holocaust. This is Holocaust Remembrance Month. And I want to pick up the story. So, Dina's father, mother, and siblings escaped Germany, made their way to Holland, then made their way to the United States. Many of Dina's family is still in Holland. In 1940, Germany invades Holland. All of a sudden, Dina's family has lost contact with all those relatives who are in Holland. They're in the United States, they don't hear for years. The war ends in 1945. You're all in the United States, and then you get a letter from the German government. And I think, Dina, you personally had that letter in your hands. So, Dina, can you talk about this letter?
It arrived in the mail. And you know, I was the youngest in the family. I was born in this country in 1940. It was kind of a whoops, I think, but fortunate to have enjoyed that opportunity to be a U.S. citizen. But I would run to the mailbox and bring in the mail. And I remember, you know, anything that came from a foreign country was so important. And so I gave it to my dad. And unfortunately, it was from the Red Cross, informing him about the murder of the family I mentioned before, his 3 sisters, nephew, niece, brother-in-law, and his mother at Auschwitz in 1943. They were between September and October of 43, they were all killed. So the Germans were very, very good about keeping records, and their death date was established in the records.
They were all sent to the gas chambers.
They were all sent to Auschwitz, and yes.
How did your father react to this absolutely horrific news when he opened that letter?
It was horrible. I remember to this day the wailing. I had never seen my father cry. Even through all the hardships, he would keep a pretty stoic mien because he was a father of a young family. But this one was memorable beyond all belief. And I think it led to intermittent depression. Holidays were very hard. And that's why we didn't talk about this much, because it brought up so much sadness. And as I said in one letter that I wrote to the editor, I think my parents both suffered from post-traumatic, what would today be diagnosed as post-traumatic syndrome. And even my older brother and sister, I think, had bouts of that. It's real when you suffer such unbearable results of hatred and the horrendous news that you have a whole generation of family that was killed.
How do you make sense, if you can, of what happened to your family? All those close relatives exterminated at Auschwitz, 6 million others murdered because of their religion. How do you make sense of all that?
Well, I have found wonderful quotes that we all know. The one from, what's his name? I've got it on the front of this tome of literature, but prominent, the pastor from, that said, Niemöller was his name. First, they came for the socialists, and I did not speak out because I was not a socialist. Then they came for the trade unionists, and I did not speak out because I was not a trade unionist. Then they came for the Jews, and I did not speak out because I was not a Jew. Then they came for me, and there was no one left to speak for me. Now that haunts everybody, I think, and you hear it often when we talk about this, but a more recent survivor of the Holocaust at the 70th anniversary of the freeing of Auschwitz said that we do this for our grandchildren. And I'll read you the quote. It was simply, we cannot let our past become our children's future. And that became very apparent, or struck me, when we first started seeing this resurgence of anti-Semitism and divisiveness that started happening after the Charlottesville death of the young woman by someone running her over in a car, which is scary. While that when people are trying to legitimize, you can run over protesters by laws across the country. I mean, that's chilling. But when that started happening, and then I had a young relative who just one generation, 2 generations, and they've forgotten this heritage, this awful heritage, but important to believe in how fragile our democracy is. That it happened in a very civilized, one of the seats of culture in the world, Germany, that produced great musicians and authors. And how could that happen in that kind of a civilized country? Because hatred of people unlike yourself exists. And unfortunately, we see some of that happening around us in this country. And I guess that's what spurred me on to my late in life activism in speaking out on this issue, and making sure that my grandchildren and my nieces and nephews' grandchildren, or children and grandchildren, know their heritage so they can speak their truth to power when awful things start to happen around them. Like we lived in Pittsburgh for a year. The Pittsburgh synagogue there was a horrible massacre there just a few years ago. When these things start cropping up, we have to speak up. And I'm not a Holocaust survivor. I'm a child of the Holocaust. But I do know what a devastating effect it had on my family. And I certainly don't want that to be the case in this country.
And you just started speaking out about this a couple of years ago. Publicly, that is. Most people did not know this story of yours. So I give you credit because obviously it's a very painful story to tell. I want to bring this to present day. As you know, horrible day in American history, January 6th. Insurrectionists stormed the Capitol, many of them white supremacists. And there's this shot of one of the rioters wearing a sweatshirt that said Camp Auschwitz. And here you are, your grandmother, your aunt, so many other relatives were exterminated at Auschwitz. So in 45 seconds, can you tell me your reaction to seeing that person wearing that sweatshirt on that day?
I was appalled, and it again reinforced how little we know about our own history and the history of the civilized world and current events. That to me showed what kind of people were storming the Capitol. They had no depth of understanding of what that shirt even meant, because I can't believe that even the biggest rednecks in the world wouldn't understand the connotation of that shirt and how hurtful that would be to the Jewish people, to anyone who had any sensitivity toward mankind.
Dina, I know it wasn't easy, but thank you so much for telling that story. It's a story people need to hear, need to know. Keep telling us so we don't forget. God bless you, and keep fighting, and thanks so much for joining us today.
Thank you for having me. We have to keep speaking out. We have to speak our truth to power, that's for sure.
Thanks again. And I will be back with some final comments right after this.
Do you worry about going to the dentist? After all, a visit to the dentist can easily cost $2,000 or more. Well, relax. The Carefree dental card is now available in your area. Call now and we'll send your actual card at no cost today. With the Carefree dental card, you go to the dentist whenever you need and you instantly pay a lot less. Activate your card and you can start using it immediately. From exams and cleanings to more expensive procedures like crowns, dentures, even braces, they're all included with the Carefree dental card. Say you go to the dentist today without any card and your bill is, well, ouch. Wait a minute, let's try that again. You go to the dentist today and show your Carefree dental card, you save $525. The Carefree dental card is just $15.95 a month, so call now and make going to the dentist carefree.
Call 1-800-416-5739 to receive your Carefree dental card information kit. 1-800-416-5739. Call now.
I can't say enough good things about these nano hearing aids.
Real people talking about nano hearing aids.
The hearing quality is great.
Until now, hearing aids used to be too expensive for the average person. Until nano. Call now and you'll get your nano hearing aids for only $297. You'll save $100. When you buy one hearing aid, Nano will give you a second hearing aid free. Call right now.
1-800-213-3815.
Spas, etc. Yeah.
You've come to know and trust us for over 18 years with the largest selection and showroom in Western North Dakota for our beautiful Sundance spas. Plus, you could pick out your next home experience with our selection of pool tables, shuffleboards, and fun accessories.
Spas, etc. Your relaxation destination on Made in Bismarck.
Who do you trust with your digital life? Not all cloud backup providers keep your data truly private. Beck Cloud Backup uses advanced multi-layer encryption to keep your family photos, videos, and sensitive business documents secure and only for your eyes. Your Beck Lightband Internet service already includes 50 gigs of free storage to keep your digital life safe and secure. Call us at 701-475-2361 to start using your Beck Cloud Backup today.
Attention! Have you or a loved one suffered from maculopathy, a serious retinal injury, after taking the prescription drug Almiron for interstitial cystitis or bladder pain syndrome? In 2018, a researcher at the Emory School of Medicine linked Almiron, a prescription drug that treats interstitial cystitis or bladder pain syndrome, to maculopathy, which is sight-threatening and can cause an abrupt change of vision.
Call Elmiron Justice for a free legal consultation.
Please call 800-395-5680.
We have heard two powerful messages today from Dr. Stephen Mcdonough and Dina Butcher. From Dr. Mcdonough, masks work, mask mandates work, social distancing works, vaccines work. So, this is me talking now. Wear a mask, social distance, and get vaccinated. We all need to protect ourselves and protect each other. Some say not wearing a mask is about freedom. What freedom is that? The freedom to infect other people? Where is that in the Constitution? Governments enact laws to protect you, whether they are speed limits, drunk driving laws, or not allowing murder. Mask mandates are no different. The North Dakota legislature has passed a bill that would ban statewide mask mandates. It's one of the worst and most dangerous bills I have ever seen. This pandemic is not over, and there will be another one after that. Congrats to Governor Burgum for vetoing this irresponsible bill. The lesson from Dina Butcher is never forget the Holocaust and never let it happen again. It needs to be taught in our schools. Too many people do not know about it. White supremacy and hate crimes are on the rise in the United States. We must speak out against this. Silence is unacceptable. Remember the words of the great Elie Wiesel, a Holocaust survivor and Nobel Peace Prize winner, who said, "We must always take sides. Neutrality helps the oppressor, never the victim. Silence encourages the tormentor, never the tormented." That will do it for today. I want to thank Joel Heitkamp for having me fill in today, and I look forward to seeing you again sometime soon on Down the Road. Bye-bye, everyone.